Oh, didn't see you there. Now you're probably wondering why I'm at home in my pajamas, wrapped in a delightfully warm blanket on a weekday. Probably saying something like, doesn't this guy work? Well, of course I do. In fact, I'm working right now. Yes, this is just a mere glimpse of the lifestyle of a work-from-home healthcare professional, a new trend amongst the healthcare industry. Haven't you heard of it? No? Well, we can't have that. Pour yourself a cup of coffee and pull up a chair as I wrap you in a cozy blanket of our story. Remote work is a non-traditional work setting that has virtually swept the nation in the last 2 decades. With technology allowing us to connect in almost every way imagined, why not? Doctors can see and assess some patients with web cameras. Behavioral health counselors can do on-the-spot sessions for patients that have an immediate need or very difficult schedule. Case management and wellness nurses can help educate patients over the phone on their plan of care and eligible benefits. The ripple effects of working from home are very different for each participant, particularly in terms of healthcare services. For the patient, it can help greatly as they now simply call the provider's office without having to go in. It gives them the flexibility to get the help they need when they need it. For healthcare professionals, when it's possible to work from home, it adds flexibility for their family or for an optimal work-life balance. Sometimes nurses dislike not being able to interact face-to-face with the patients like they're used to. Frankly, any remote working can sometimes have issues with being secluded from other co-workers. And lastly, the health plan or hospital must consider the effect it has on the organization. To be managing staff that are at home, sitting with little or no immediate supervision or face-to-face guidance. Performance metrics become the standard to which the team must be measured. Not some punch clock to track the number of hours spent on site, but truly a measure of productivity. Most medical centers, hospitals, managed care organizations, and their affiliated provider networks have positions that can be performed from a home office, as well as many that simply must be on site. Finding that balance can be difficult, and in our growing and changing world, it's important to be flexible and try to be open to new ideas. Well, that concludes today's vlog with Care National. I'm Michael, and looks like it's time to get back to work. Oh, looks like the muffins are ready.